So greetings and salutations. I'm Dr. Edward Park, and you're here with Face and Body. So I have my lovely patient care coordinator here that we're gonna roll towards, and she already had her implant surgery, but we're gonna go over the technique of how we do implant massage. And generally speaking, we're gonna move the implant in three directions. I like to think of, if everyone saw The Little Mermaid, Sebastian was the crab claw, and you're going to think of crab claws and pinch and move the implant around using that technique. So the three directions we want to go are up, in, and down. So we're going to show the upwards motion, and as you can see, she's grabbing the implant and pushing it up. You can see the implant move upwards. So that's a very easy motion. She's pushing and squeezing. Then we're going to move to the sides, and then we're going to push and squeeze the implant inwards. This is going to open up the cleavage and get this very nice close together cleavage. And so she's again pushing and squeezing. Now the challenging motion is going to be getting the implants to drop and letting the nipples rotate up. And so this motion can be demonstrated in three ways. The easiest technique is to get someone's iPhone, preferably yours, the owner's, and then place it right on the upper pole, and as she pushes right into her chest wall, you can see the lower part of the implant going downwards. So release, and again, look at that motion right there. The implant is going steadily into that pocket. And she's holding for a good 3 to 5 seconds. And that's super important to stretch and hold, just as if you were running or preparing for a marathon and stretching your quads for a run. The second way to push the implant down is to go ahead and use your hand, and same technique, you're just going straight in, pulling the skin upwards a little, and again, look at the lower pole, stretch out with the implant. So we're going to do that again, and she's holding, and again, there's that stretch. And we're getting the implant to move down and fall into the pocket. The final technique is to use two hands, where she's going to interlock her fingers and almost use her palms as kind of a vise to squeeze from above, and you can really get good force this way, and you can see again the implant dropping into that lower pole. She's holding, she's releasing, and here we go, it's rounding out, and there we go into that lower pocket. So that technique I like to use, especially if someone's a little bit more stuck. You can get more power with a two-handed technique. I generally like my patients to implant massage for anywhere from that first week out. We generally start at that point, and then implant massage until they fall into the pocket at about 2 to 3 months. When they're settled into position, I will then transition them over to a daily self-breath exam in the shower, just to give the brain some feedback on how the implants are feeling and that they're staying soft for the lifetime that they're in there. So any questions, please subscribe, and we're happy to answer them.